A 72-year-old patient once told me, "Doc, I've been doing it this way for 50 years, but recently something just feels off." This story is about a man who wasn't sick, wasn't on new medications, but was deeply affected by a private habit masturbation done the wrong way. It's not about age or illness. It's about private habits that can quietly damage your health over time. I'm Dr. Ron Peterson, a urologist with over 45 years of experience helping men maintain their health, confidence, and vitality. Stay with me, because in just a moment, I'll share the 7 common mistakes older men make during masturbation and how to fix them before they affect your energy, performance, or long-term health. Many men in their 60s and 70s have told me, "I can't seem to feel much anymore during intimacy. It's like my body is numb." This is a common concern among older men, and it's not about physical health, but rather about the habits that have developed over time, especially the use of pornography. Over the years, I've noticed that many older men rely on porn as a primary form of stimulation. While it might seem harmless at first, the problem arises when it becomes a daily or frequent habit. Pornography, especially with the high-speed, high-intensity content available today, overstimulates the brain in ways that it's not designed to handle. The brain's dopamine system, responsible for pleasure and motivation, becomes overwhelmed and overstimulated by the constant bombardment of graphic images or videos. This excessive stimulation creates a kind of desensitization effect. When we're younger, our brains can bounce back more quickly from stimuli, but as we age, our brain's ability to adapt and recover becomes slower. The constant flooding of dopamine caused by regular porn usage doesn't allow the brain to reset or return to a normal state. It starts to require more stimulation to achieve the same level of pleasure, and the body becomes numb to more natural experiences of intimacy.
This overstimulation leads to a diminished response to real-life intimacy, making it harder for men to feel the same level of pleasure or connection with a partner. They begin to rely more on the artificial rush provided by porn, which further deepens the disconnect between them and their own physical and emotional well-being. The consequences of using porn regularly are profound and often misunderstood. The first and most obvious effect is a loss of sensitivity. Because the brain becomes conditioned to expect intense stimulation, the natural sensations of physical touch, intimacy, and closeness don't feel as rewarding. Men may notice that even during real encounters, they struggle to connect with their partner, both physically and emotionally. It's as if their body no longer responds in the same way it used to, and they might blame themselves, thinking it's simply due to aging. However, the issue is not age itself, it's the brain's response to overstimulation. Men can still feel pleasure and connection, but they need to retrain their brains and bodies to respond to more natural forms of intimacy. Another major consequence is a breakdown in emotional connection. Masturbating to porn tends to isolate men in their experience, whereas intimacy with a partner is about shared moments and connection. Over time, this lack of connection can lead to feelings of loneliness, disconnection, and a loss of overall satisfaction in relationships. On a deeper level, the reliance on porn can also affect a man's self-esteem and sense of identity. When a man feels numb to intimacy, it can lead to feelings of inadequacy, frustration, and even shame. This cycle reinforces the belief that they've lost their sexual vitality and connection with their partner, when, in reality, the problem is much more complex and tied to their consumption of porn. The solution to this issue is simple, yet requires effort and awareness. The first step is cutting back or completely eliminating porn from the routine. The brain and body need time to reset, and this is only possible when they are no longer bombarded by artificial stimuli. Next, it's important to focus on natural forms of arousal and intimacy. The goal is to reconnect with the real sensations of touch, the emotional connection, and the pleasure of physical closeness. This might mean exploring new ways to connect with a partner, focusing on emotional intimacy, or even rediscovering the value of slow, mindful sexual experiences. For men who find it difficult to achieve satisfaction without porn, it's essential to introduce gradual changes. Start by reducing the frequency of porn use, then replace it with other activities that promote connection, like engaging in deep conversations with a partner, practicing mindfulness, or exploring other forms of self-pleasure that involve the entire body, and not just the mind. Lastly, it's crucial to give yourself grace. Restoring the natural balance of pleasure and intimacy takes time, but with patience and awareness, you can regain a deeper sense of connection with yourself and your partner.
By retraining your brain and body to respond to natural stimuli, you can reverse the effects of overstimulation and begin to experience the full depth of intimacy and pleasure once again. If you recognize this in yourself, type 1 in the comments. If not, share this video to help others. It may seem harmless at first, but masturbating while sitting on the toilet can seriously harm your circulation and overall health. Many older men have quietly developed this habit, not realizing the risks it poses. When you sit on the toilet, especially in the hunched-over position that many adopt, pressure is placed on the pelvic region, including the prostate. This position restricts blood flow to the pelvic area, which is crucial for healthy sexual function and overall circulation. Over time, the pressure on the prostate can lead to complications, as the prostate becomes constricted and the surrounding muscles and nerves suffer. In particular, the prolonged pressure can negatively impact the delicate nerves that are responsible for sexual arousal and function. Additionally, this position doesn't allow for optimal blood circulation, which is essential for maintaining erectile function and overall sexual health. As men age, the need for proper circulation becomes even more important to preserve prostate health and avoid issues with urination. Unfortunately, many men don't realize that their seemingly harmless habit of using the toilet as a private space for self-pleasure can be damaging. The most immediate consequence of this posture is the restriction of blood flow to the pelvic area. This reduced circulation can contribute to difficulties with urination, such as post-urination dribbling or trouble fully emptying the bladder. These issues are often seen in older men, but they may never connect them to the habit of masturbating while seated on the toilet. In addition, the pressure on the prostate can exacerbate conditions like prostatitis, inflammation of the prostate, or benign prostatic hyperplasia, BPH, both of which are common in older men. Over time, this pressure can also lead to nerve damage in the pelvic floor, which may result in sexual dysfunction or loss of sensation during intimacy. The compounded effects of poor circulation and pressure on the prostate could worsen over time, making intimacy and urinary health more challenging. Another issue that can arise from prolonged sitting in this position is the compression of the pelvic floor muscles. These muscles, which support vital functions like bladder control, erections, and sexual health, can become weakened or strained. As a result, men may experience an overall decline in sexual health, reduced sensation, and less control over urinary functions. The solution is simple and effective: change your position. Instead of sitting on the toilet, try standing or lying down on your side when masturbating. These positions allow for better circulation and reduce the strain on the pelvic region, making it easier for blood to flow freely to the pelvic organs, including the prostate. Standing up or lying on your side will alleviate pressure from the prostate and pelvic muscles, ensuring that the blood flow to these areas isn't restricted. Additionally, these positions help protect the sensitive nerves in the pelvic floor, preventing long-term damage. By giving your pelvic region space to breathe and circulate, you're allowing your body to function more naturally, supporting both sexual health and urinary function. If you find that this habit is hard to break, consider creating a more comfortable, private space that encourages relaxation and mindful self-pleasure. You might also experiment with other positions that promote circulation, such as sitting in a reclined position or using a comfortable chair, so that you're no longer placing unnecessary strain on the pelvic area. The key is being mindful of your body's needs and making small changes that can significantly improve your long-term health. By paying attention to the effects of your posture, you'll notice a difference in how your body responds, and you'll protect both your sexual health and overall well-being. Masturbating while sitting on the toilet may seem like an innocuous habit, but it can silently impact your circulation, prostate health, and sexual function. By simply changing your position, standing or lying down, you can reduce the risk of nerve damage, improve blood flow, and maintain a healthy pelvic region. The result will be better sexual health, improved urinary function, and greater overall well-being. Take action today and protect your body by adopting better habits that support long-term health. Many older men rush through self-pleasure, treating it as a task to complete rather than an experience to enjoy. They hurry to finish, believing they don't have time to linger. This rush diminishes the experience and leads to a loss of connection with their own bodies. When you rush through self-pleasure, your body doesn't have the time to relax and fully engage. As a result, the nervous system is activated in a state of tension, which interferes with the production of beneficial hormones like oxytocin and dopamine.
These hormones are crucial for feelings of happiness, relaxation, and emotional bonding. By rushing, you prevent your body from releasing these important chemicals and miss out on the full rewards of the experience. In a rushed state, the body also doesn't have the opportunity to enter a fully aroused or relaxed state, which reduces the intensity of pleasure. Instead of feeling deeply satisfied, the experience feels more like a quick release, leaving a sense of emptiness afterward. The rush prevents your body from truly absorbing the relaxation and pleasure that self-pleasure can bring. The immediate consequence of rushing is a decrease in sensitivity. Because your nervous system never reaches a relaxed or fully aroused state, the sensations you experience are less intense. Over time, this can contribute to a reduction in overall sexual sensitivity, making it harder to feel pleasure or connect with your partner. Additionally, the rushed experience prevents you from feeling fully connected to your body. This lack of connection can affect not only your sexual life, but also your overall emotional health. The quick, detached nature of rushed self-pleasure can lead to a sense of disconnection, leaving you feeling empty or unsatisfied afterward. Moreover, the habit of rushing becomes ingrained, which reinforces the pattern of treating sexual experiences as quick tasks rather than enjoyable moments. This routine disconnects you from your own pleasure and from any deeper emotional connection with yourself or your partner. Over time, this mindset can lead to dissatisfaction in intimacy, as both the physical and emotional aspects of pleasure are diminished. The solution is simple yet transformative. Slow down. Take your time and savor each moment of the experience. When you approach self-pleasure with mindfulness and intention, you give your body the space it needs to fully relax, engage, and enjoy the sensations. By slowing down, you allow your body to naturally produce hormones like oxytocin and dopamine, which enhance your emotional well-being and deepen your connection to the experience. These hormones help you feel more relaxed, satisfied, and connected to your body, creating a positive feedback loop where the experience becomes more fulfilling each time. You don't need to focus on finishing quickly. Focus on enjoying the journey instead. Pay attention to how your body feels, where the sensations arise, and what areas of your body need more attention. This approach not only increases the intensity of pleasure, but also promotes a deeper connection with yourself and your body. Take time to breathe, pause, and reflect on the experience. Allow each moment to unfold naturally, without rushing toward the end. Doing this will not only enhance your self-pleasure experience, but also improve your overall sexual health and emotional well-being. By slowing down, you can restore the depth of pleasure and connection that might have been lost over the years. Rushing through self-pleasure might seem like a time saver, but it ultimately robs you of the full experience. By slowing down and giving your body the time it needs to relax and fully engage, you can rediscover the true benefits of self-pleasure. This change will not only improve your sensitivity and satisfaction, but also help you reconnect emotionally and physically with yourself. Make the shift today. Enjoy each moment and allow your body to feel, breathe, and experience pleasure in its fullest form. If you recognize this in yourself, type 1 in the comments. If not, share this video to help others. The pelvic floor muscles are one of the most important muscle groups in a man's body, yet they are often neglected, particularly after the age of 60. These muscles play a crucial role in various functions, including sexual health, urinary control, and even erectile strength. Unfortunately, as men age, they tend to overlook this area, not realizing the impact it can have on their overall well-being. The pelvic floor muscles form the foundation of the pelvis, supporting the bladder, prostate, and sexual organs. They are responsible for controlling urination, maintaining erection strength, and contributing to sexual pleasure. When these muscles are strong and engaged, they provide stability and functionality to the entire pelvic region. However, over time, especially after the age of 60, the pelvic floor muscles can weaken due to factors such as prolonged sitting, lack of exercise, or even stress. As these muscles weaken, they lose their ability to support the organs they once helped stabilize. This results in a variety of issues, such as difficulty controlling urination, reduced erectile strength, and diminished pleasure during sexual activity. When men don't take care of their pelvic floor, they might experience embarrassing issues like leaking, dribbling, or a lack of sensation during intercourse, all of which can significantly impact their confidence and quality of life. The consequences of neglecting the pelvic floor are both physical and emotional. As the muscles weaken, urinary control becomes a major concern. Men may experience urinary incontinence, which leads to frequent trips to the bathroom, difficulty fully emptying the bladder, or even leaking during certain activities. This can cause discomfort, frustration, and a sense of loss of control. Moreover, weakened pelvic floor muscles can contribute to erectile dysfunction, ED, and decreased sensation during sexual activity. Without the strength and stability of these muscles, achieving and maintaining an erection becomes more difficult. The lack of support can also diminish the ability to experience deep pleasure, leaving many men feeling disconnected from their bodies. This creates a vicious cycle. Poor sexual health and urinary control can lead to emotional distress, which further weakens the pelvic muscles, causing more physical problems down the line. But the good news is, it's never too late to reverse these issues. By paying attention to the pelvic floor and incorporating simple exercises, men can restore strength and functionality to this important muscle group. Advice for elderly men in particular often focuses on strengthening the pelvic floor to improve quality of life and sexual health. This approach doesn't just alleviate physical discomfort, it can also boost confidence, reduce the risk of incontinence, and enhance sexual performance. The key to overcoming these issues is pelvic floor exercises, also known as Kegel exercises. These exercises are designed to strengthen the muscles that support the pelvic organs and improve their overall function. By regularly engaging the pelvic floor, men can regain control over urinary function, improve erectile function, and enhance their overall sexual experience. To perform Kegel exercises, start by locating the muscles you would use to stop urination midstream. Once you've identified these muscles, gently contract them and hold for 5 to 10 seconds before releasing. Aim to perform 10 to 15 repetitions per session, ideally 3 times a day. Over time, these exercises will help improve pelvic floor strength, resulting in better urinary control and stronger erections. It's important to remember that consistency is key. Just like any other muscle group, the pelvic floor muscles require regular exercise to stay strong. Make pelvic floor exercises a part of your daily routine, and you'll begin to notice improvements in your ability to control urination, maintain an erection, and experience greater pleasure during sex. If you find it difficult to perform the exercises or are unsure about your technique, consider speaking to a healthcare provider. They can provide guidance and even recommend physical therapy to ensure you're targeting the right muscles. The pelvic floor is a vital, yet often overlooked, part of a man's body, especially as he ages. Ignoring the pelvic floor can lead to issues like urinary incontinence, erectile dysfunction, and reduced sexual satisfaction. However, with the right attention and exercises, it's possible to strengthen these muscles and improve overall health. By incorporating pelvic floor exercises into your daily routine, you can not only improve sexual health, but also regain confidence and control. For elderly men, the importance of this advice cannot be overstated. Strengthening the pelvic floor is key to maintaining a high quality of life, both physically and emotionally. We've just explored 7 common mistakes older men make when it comes to self-pleasure. These are habits that stem from a lack of awareness about the body and poor choices that can significantly affect health and sexual well-being. But it's important to understand that these mistakes don't define you. You can always make adjustments and reclaim control of your health, especially when you're given the right advice and guidance. The truth is, it's never too late to take charge. With just a few small changes and by being more mindful, you can restore your vitality and confidence, no matter your age. The key is to listen to your body, and don't be afraid to take the necessary steps to improve your overall well-being. So remember, advice for elderly men is not just about maintaining physical health, it's about taking a holistic approach to your well-being. By making these simple changes, you can improve not only your sexual health, but your overall quality of life. If this video has been helpful, don't forget to like, share, and pass it along to other men who could benefit from hearing this. Together, let's spread the word about the importance of healthy habits for a fulfilling life, no matter your age.